your entire true health diagnostic blood work. This is the most expanded cardiovascular risk reduction blood work you can get anywhere in the world. Okay. Now we are going to go through step by step. Okay. So the first question is, you're 47-year-old. Are you premenopausal, perimenopausal?
Nothing yet so far that I know.
Nothing else. The reason I ask the question is, you're one of the factors you have in your blood test is called LP little a. We categorize cholesterol as good cholesterol, bad cholesterol, ugly cholesterol, and deadly cholesterol.
Okay.
Good cholesterol is HDL, bad cholesterol is LDL,
Okay.
and ugly cholesterol is triglyceride. Deadly cholesterol is LP little a.
Okay.
You happen to have the problem of the worst, which is called LP little a, the deadly cholesterol. On top of that, you have the other stuff as well. Your triglyceride is high, which is the ugly cholesterol. Your LDL cholesterol is high. We want the triglyceride to be below 70.
Oh,
But
below
you are
70.
148.
Oh.
And your LDL particle number is 1630. We want it to be below 700.
Oh.
Okay. Your LDL total count is 139. We want it to be below 70.
Oh.
Your HDL, good cholesterol, should be more than 50. You are 45.
Okay.
So, your good cholesterol is low.
Right.
Your bad cholesterol is sky high, including LDL particle number. Your ugly cholesterol is definitely high. And then your deadly cholesterol, LP little a, is 150. It should be below 75.
Okay.
The reason I asked you whether you are perimenopausal or not, when you become menopause, your estrogen protection is gone. At that time, the LP little a becomes truly deadly, meaning thereby your coronary artery disease will become worse and worse very rapidly.
Okay.
And so what does that mean is as of now, we are going to control all the risk factors that we know based from your blood test. So we protect you day by day, rest of your life.
Right.
Patients like you who have come early, even younger than you, who have high LP little a, we are able to protect by doing this thing.
Good.
Okay. On page number 1, we have covered all the cholesterol issues, and you have all 4 risk factors.
Okay.
Of all the 4, the worst is LP little a, which you happen to have.
Right.
Additionally, what you need to know is LP little a is inherited.
Right.
In other words, your children, your brother, your sister, your parents, everybody should be tested to see if you have the problem.
Sure.
And because it is an inherited problem. Indian people, 25 to 30% of people have high LP little a problem.
Okay.
Okay. And so that is that. Next page, we go to inflammation markers. Your inflammation marker, HSCRP, is 3.1 and normal should be less than 1.
So what is CRP?
CRP is C-reactive protein, which is a vascular inflammation. Inflammation that is happening in your blood vessels. And that inflammation is causing more deposit of fat, which is called atherosclerosis, and also increase the chance of the rupture of a plaque that can cause heart attack or stroke, which we call as brain attack.
Right.
That is why this inflammation has to be, inflammation has to be reduced. Okay. And you can write on this one.
Okay.
And so that is one thing. And
Thank you.
your other inflammatory markers like LPPLA2, myeloperoxidase, and homocysteine are not high, but HSCRP is high.
Okay.
Okay.
So this is this thing for Atherosclerosis.
Atherosclerosis. Okay. Next one we look at is myocardial stress, whether there is already any damage to your heart that is putting a stress on it. Answer is no.
Okay, good.
And then your cholesterol absorption category is normal, and then but your cholesterol happens to be high. And the next page we'll look at is the opposite of inflammation. If you have inflammation, how can you counter it?
Right.
There are two major ways you counter inflammation. Number one, cooking oil. What is the cooking oil do you use?
Olive oil.
Olive oil, good. If you eat olive oil, it is good for you,
Yeah.
but if you use a safflower, sunflower, soybean, corn oil, these are called vegetable oils. They are not good for
That
you
I
because
read
they
is
are
not good, yeah.
pro-inflammatory,
Right, right.
omega-6
6 is
oil,
high, yeah.
and it increases your inflammation.
Exactly.
Next thing you need to know is there an oil that you can eat that will counter the inflammation? The answer is yes. And that oil happens to be fish oil.
Fish oil.
And we recommend fish oil capsule, not eating fish.
No.
Eating fish will not give you enough of the fish oil.
Right.
You need to eat the capsule.
That's what I'm
How much you should consume? You should 3 to 4 gram of EPA DHA. And your omega-3 index is 7.5 and our goal is 8.
Okay.
So you should increase, you should take 2 to 4 gram of EPA DHA as a fish oil after breakfast in the morning. That will help you to reduce the inflammation.
Okay.
One more thing very interesting I noticed is your trans fat total is 0.8. I like to see it below 0.5%,
Okay.
which means you're eating a lot of cookies, crackers, and chips, and perhaps fried food.
Okay.
Is that true?
No fried food, but the cookies and chips, yes.
Yes. Cookies and crackers and chips
Chips,
have
crackers.
trans fatty acid. I'll tell you why.
But I picked the ones without that.
No,
still
but
it is
here,
there, no?
here is the problem.
Oh, okay.
The trans fat law, the law that dictates in California that you should label if it contains trans fat is if it is beyond certain limit. But there is up to certain limit, they don't have to declare it.
Okay.
But if you do not put that little bit of trans fat into it, which is called hydrogenated oil,
Yeah, I don't
then
take that,
it
yeah.
does not have shelf life. It starts becoming stale. So in order to increase the shelf life,
They put
put hydrogenated oil, and they put such a minuscule amount that they can get by not labeling it.
That's the
That is why cookies, crackers, and chips.
Okay, no.
And I see that you're eating a lot of it because you're 0.8, and I want to see it 0.5 or less.
Okay, that I will watch out for.
Okay.
Yeah.
Now, next page we're going to look at is your insulin resistance, which is a major risk factor, and you are pre-diabetic because your hemoglobin A1C is 5.7.
But isn't 5.7 good? No?
No, not good.
Oh.
Less than 5.6 is correct.
Oh.
You already have insulin resistance because your adiponectin is low.
I
Your
noticed that.
estimated average glucose is 117, and normal should be lower, like close to 100. And then your insulin fasting is 11, normal should be below 3. That is why you have insulin resistance. Based on this, I do recommend that you should go on metformin, in a long-acting metformin, 500 milligram once a day. I recommend it for you. Sometimes you need it twice a day. And then metformin decreases your insulin resistance, and it decreases circulating insulin, thereby prevents even atherosclerosis. Additionally, metformin prevents things like colon cancer, Alzheimer's disease, and everything else. That's why I strongly recommend you should start metformin extended release 500 milligram once a day. Okay, we may increase it to twice a day. Side effect: in some people it causes mild diarrhea, some people it causes mild constipation. But you can deal with it,
Right.
and we can teach you how to deal with it.
Okay.
Next point is you do have a problem of a very low vitamin D, which is a metabolic factor that also increases your atherosclerosis and cardiovascular
So I am
risk.
taking that as a supplement because I noticed this 2 years ago. I went very low and I was feeling extremely tired. So they did the D3 test and I was very low. So they
Not
put me on
enough.
a supplement. So
Not
what
enough.
is it? Is it 1,000
We need
milligrams
to
a day or 2,000?
4 to 5,000 units
Oh my
per day.
God.
And we recommend even 4 to 5,000 units of vitamin D3 once a day, plus 50,000 units once a week. In 1 month, you become normal. After that, you can just do 50,000 units once a week.
So 50,000 units is what? 2,000 milligrams or
No,
1,000?
50,000 units of vitamin D once a week,
Mhm.
and 4 to 5,000 units once a day.
Wow.
Okay, in 1 month you will become normal. Okay,
One day.
Yeah.
Okay.
then you can cut down.
So you're gonna prescribe this to
I
me?
will
or-
prescribe that to you.
Okay.
Next page, we have seen your ANA is negative, so you don't have lupus. Your rheumatoid factor is slightly high at 20, normal is 14. You do not have celiac disease, and you do not have any of the other. And your white cell count, red cell count, and the
Is
liver function and kidney function are completely normal.
Okay. My
You don't have
hemoglobin
any,
is fine.
no
everything's
problem. Calcium is normal.
Yeah.
So in general,
Uh-huh.
we have reviewed your True Health diagnostic lab work.
Right.
You have very high risk of coronary artery disease.
Okay.
Along with that, you have risk of stroke
Mhm.
and the risk of even Alzheimer's disease based on the factor that you have atherosclerosis and high insulin resistance.
Mhm.
Okay?
Okay.
So you should be treated by diet, exercise, medication, and supplements.
Okay.
Diet, you should be low glycemic load diet.
Low
Exercise, non-sitting as a computer worker, you should be standing and working,
Okay.
and walking 10,000 steps a day.
Okay.
And then, of course, medications, we are going to recommend statins. You should start on rosuvastatin 10 milligram once a day, and CoQ10 200 to 300 milligram once a day, and fish oil 3 to 4,000 milligram, that is 3 to 4 gram per day. And then vitamin D, I already mentioned 5,000 unit once a day.
Okay.
And then you should be on cooking oil should be no omega-6, and that in short is your prescription.
Right. Is coconut oil safe or no?
Coconut oil is omega-6, omega-3 neutral.
That's
It is
all.
a non-inflammatory.
Right.
You can use that, no harm.
Okay.
There is so much controversy
That's
on it,
what,
but do not
Because
worry
they
about
say
it.
all the same CT and this and that, and then they also say it's
Yeah.
for the plaque and heart disease it's not good, and then so much.
No, the MCT is derived from coconut oil, but it does not function as coconut oil.
Right.
Coconut oil has lauric acid, which is C12,
Right.
caprylic acid and capric acid. Caprylic is C8 and capric is C10. So it has C8, 10 and 12. And the C12 is the one lauric acid that is more saturated. But MCT oil is caprylic and capric, which is C8 and 10, which is totally safe because we use it for ketogenic diet. It is immediately consumed as calorie, and it does not get deposited as fat. It is non-atherogenic.
Oh.
It does not cause atherosclerosis.
Okay.
Okay?
Okay.
So that is in short your prescription. Okay?